are back here on Healthy Living. Once again, we're here with Dr. Cal Sharp. I'm so excited to talk with you. It's a fascinating subject. And it's kind of the more you know, the more you know.
Right.
Right? I mean,
Right.
it really is interesting. And we were talking about the heart as a muscle. And I think what's so helpful is when you put it in lay terms, it's a fuel line. It's
Right.
it's a pumping chamber.
Right.
It's really interesting. I would love to talk a little bit about symptoms.
Sure.
First of all, symptoms that men may experience, women may experience. Does it differ over age?
Right. Well, certainly your typical symptoms, your sort of classic symptoms of obstructive coronary artery disease or cardiac or heart problems typically may be more related, the most common issues related to the fuel line limitations or obstruction of the coronaries or blockage of the heart blood vessels. And so if you think of the heart as an engine or a pump that's supplied by fuel lines or heart blood vessels, if you have a limitation to that, if you have an obstruction,
piece of debris in
you get some plaque or
yeah.
some narrowing within that fuel line, it becomes a supply-demand mismatch. So the most important aspect as far as the counseling of maintaining lifestyle modification and exercise and activity is to try to help early recognition of symptoms. So if you're an active person and you exercise and you have sort of a barometer of level of activity that you pursue, and you start realizing that you're not able to do those types of things on a regular basis, such as climb a flight of stairs or walk a couple blocks down the road or do your normal jog or run, then you find yourself maybe having some symptoms such as exertional chest pain or shortness of breath or just a decline in your functional capacity for deterioration with no other specific reason. And so I'd like to think of the classic definition of angina or coronary artery related symptoms is more of an exertional or emotionally exacerbated symptom of chest pain, tightness, discomfort, maybe a pressure, heaviness, pain, sometimes some radiation either to the jaw, the neck, or shoulders or arms associated with maybe shortness of breath or some
When a
other
patient
symptom.
comes in, I've often wondered when I recognize that.
Right.
Do people recognize that?
Well, again, it just depends on how maybe in tune they are, or maybe
fair. That's fair.
Also sort of how baseline active they are. So you were asking, as people age, or maybe they're not as active, they may not recognize symptoms until they're actually having an acute cardiac event or further down the road of presentation. For somebody who may be young and healthy and have a presentation, they may present earlier.
Like, whoa. I see.
Now, it doesn't mean that patients, even young patients, can't have acute cardiac events, but sort of a stable progression of coronary artery disease may present with sort of a stable progressive symptom complex.
So are there treatments and interventions at different stages of coronary artery disease or treating the healthy heart and moving from that point on?
Well, when somebody has a documentation or a diagnosis of cardiovascular disease or atherosclerosis, the most important treatment is aspirin.
Is it?
Low-dose aspirin. Low-dose aspirin helps inhibit the sticky cells that sticky cells can see damaged blood vessels, and they stick together to try to help repair that. But if it goes too far, it can actually clot the vessel.
and what does the aspirin do?
Aspirin inhibits the sticky cells from sticking together, and so that helps reduce one's risk of heart attacks. And then cholesterol therapy, attention to cholesterol, goals of therapy, lifestyle modification, exercise, diet, try to control your cholesterol in that regard, and then the use of cholesterol medications, typically statin therapy, Zocors, Lipitors, simvastatins, pravastatins.
And what does that do?
So plaque is essentially cholesterol that deposits within the wall of the blood vessel.
And cholesterol is what?
Cholesterol is that your body makes cholesterol, it utilizes cholesterol, but dietary management, or if your body makes too much cholesterol, the bad cholesterol, the LDL, or the small cholesterol particles can actually cross over into the wall of the blood vessel and set up an inflammatory process. And if that inflammatory process gets too great, that results in plaque. And so cholesterol medications can help not only reduce the total amount of cholesterol, but it can also help stabilize the plaque. It helps reduce the inflammation within the wall of the blood vessel, and therefore can help stabilize plaque. It may not eliminate or dissolve. It's not a liquid plumber,
Right.
but it certainly can help then stabilize the plaque and make it less likely and less friable, and therefore less likely to progress.
At what point do you get called in as an interventional radiologist, as an interventional
Right.
cardiologist?
Right.
Number one, and number two, do you also do general cardiology too? Do you do both?
Sure.
Okay.
So as an interventional cardiologist, I'm certainly trained in general cardiology.
Sure.
I get called in emergently when somebody is actually having
Okay.
a heart attack. So that's when sort of time is of the essence. That's when the presentation may be a sudden onset of, not an exertional, but a sudden onset of a severe chest pain, shortness of breath, something indicative of an actual blockage or a complete closure of a blood vessel. And that's resulting in an active acute cardiac event.
And don't
And that's
mess
sort of a
around.
bells and whistles situation,
Right.
because when there's a complete blockage or narrowing of the fuel line, then the downstream muscle
Right.
is
Okay.
in jeopardy.
Okay.
And so the most important thing to minimize or reduce the amount of downstream muscle damage, and particularly try to not just damage but cell death downstream, is time. And the most important aspect, time is muscle, is to urgently identify the blockage and try to open that blockage as fast as possible.
So your recommendation, from what I'm gathering, is if you don't feel good at home,
That's
get
right.
to the hospital.
Get to the hospital. That's right. If it's a stable situation where you find that you've been active and you're finding there's some limitations, I'm not feeling as well as I did 2 weeks ago or 2 months ago, or certainly that's where you make sure you notify your primary care physician, or you go to urgent care, or
Right.
but if you're urgently having symptoms, waking with sudden onset of chest pain, can't breathe, that's when you call 911. And it's not just get to the hospital, it's call 911 and have
Okay.
them get to the hospital, because again, time is of the essence in that situation. And EMTs are trained and to help begin the therapy. They can give aspirin in the field, they can get some blood pressure medications in the field, they can early identify by EKG whether or not it's actually an ongoing heart attack, and they can begin the process of alerting the team so that by the time they get here, we're here, and
You got this thing going.
And we
well,
got
my
the
other
thing
question is, with the virus, with this kind
Right.
of corona crisis,
Sure.
if you will,
Right.
have you found that people are like, ugh,
Well, I think to your point, symptoms are symptoms. So
Okay.
when somebody's having an acute process of acute shortness of breath or chest pain or anything, certainly an emergency is an emergency. So
Okay, period. It doesn't wait for a virus.
Shouldn't wait
Right,
for the
okay,
virus.
got
And
it.
so if you're having such acute symptoms, you call EMS, and certainly because of the virus, we as healthcare providers are taking extra precaution
Yes.
with the unknown. But that being said, on the other aspect, on the maybe not the emergency situation, so certainly we're finding that patients may be holding off on coming to physicians or to the
Okay.
doctor, or appropriately, because maybe they're just for routine visits they want to reschedule
Sure.
or that type of thing. But if they're not feeling well or they're not doing well, they need to be mindful of that. But as during the time of isolation, I guess, or self-isolation appropriately, as recommended, maybe we're not outside doing as much. We're not as active. We're not shopping. We're not walking through parking lots. We're not climbing stairs. We're not out doing some of the activities. We're not going to the fitness center where we may have recognized symptoms earlier. So maybe symptoms, coronary disease can occur, and it's not until we start getting back into our routine activities that we may start finding some symptoms where, boy, I
Yeah.
could do this 6 weeks ago, or I could do this
Exactly.
a month ago. I don't know, and that may be something that patients start to realize that, is this just deconditioning, or is there something wrong? So it is important to be mindful of your prior well-being and how things change as we start to
Exactly.
open up and get back into some activities.
And a lot of the treatment interventions that you have are very successful now.
Sure.
So people who are fearful should really pay attention to
That's right.
some of the literature. Talk to us about that.
Well, I do think that patients that are fearful or recognizing that they're not feeling well should alert their healthcare provider, and even if it's just calling and getting a telemedicine visit to share those symptoms, and then if the provider feels that those symptoms are of concern, then they can bring
Come
them
back,
in
exactly.
and bring them back in for further evaluation or make appropriate referrals for further evaluation.
It makes so much sense. And I know we've only got about a minute left, but I want to say that you are collaborating or now partners with you guys. There are lots of you together.
We are. So
That's fun.
for the last 20 years, I've been here either in private practice or subsequently with other healthcare group. Now we're merging or working with Hilton Head Heart and Tenet Cardiology services, and so myself and my three partners, Dr. McCabe, Dr. Kalin, and Dr. Westbier, are now working with Hilton Head Heart, Dr. Lawton, Dr. Ford, and their nurse practitioner Monica.
She's great. That's great.
So we are still in practice, and we have not moved or relocated, so we will be practicing with Hilton Head Heart. So.
Oh, that sounds great. Well, congratulations.
Thank
we
you.
want to thank you for your time today. You're
We're happy
easy
be
to
here.
interview.
Well,
You're
thank
great. We want to thank all of you for joining us on Healthy Living. Please have a wonderful week. Bye-bye.